This is the annual training for the use of our laser in the clinic. This applies to everyone that is going to be using the laser for patient care. An overview of what we'll be discussing today. So getting into it, some fundamentals of lasers. What does a laser stand for? It is light amplification by stimulated emission of radiation. Some components of a laser, there's obviously an energy source, a medium, as well as an optical cavity. Some basic characteristics of the laser to include monochromatic, meaning that it just has one color or wavelength. Ours is a dual wavelength of 810 and 980 nanometers. Coherent just means all of the waves are in the same direction, as you can see from the red top picture. All of the waves are all identical, as well as collimated, which just shows, as opposed to a light bulb that spreads light in all direction, a laser has a very low divergence, and you can see there at the bottom. Some fundamentals of lasers, once again, were the 810 and 980 nanometer range. The maximum permissible exposure is just the level of radiation to which an unprotected person may be exposed to the eyes or the skin, the accessible emission limit, and the optical density. So the categories of lasers is military specific, which this does not fall under, an FDA compliant, which it does, as well as there's also research lasers. Some of the effects that can occur that we are most concerned about is with the eyes. This is just a description of the different parts of our eyes. So things that can happen is retinal damage or damage to the retina that occurs during our wavelength if we are not using proper PPE, especially our glasses. Corneal and lens damage can also occur, especially with the nanometer range that our laser does put out. Some of the effects can be a glare, blindness, cataracts, retinal hemorrhage, and retinal burns. So this laser is obviously meant for cutting tissue. This discusses going through skin and what nanometers that occurs, but that's obviously why we purchased the laser in the first place, is to cut tissue, and that can happen. These are some of the effects of different types of lasers, such as laser pointers, laser hair removals. So the viewing conditions, obviously don't do this. Do not point the laser in your eye to see if it's working. Always make sure, if the laser is ever on, that you do have the protective eyewear in place to include you, the patient, and the provider. So types of laser exposure, just as you saw from the last one, is the laser directly viewed by the eye. The other things that can happen is what's called specular deflection, where the beam is reflected off of a mirror-like surface, and then diffuse reflection, which it can be scattered from any kind of surface in the DTR. And that's what this goes into a little bit more in detail about the specular reflection in the mirrors that we would use. We are covering up the mirrors in the DTRs, and at least the mirror that we could use, we most likely will not need them in some of our procedures. But to be very careful if we ever do. The diffuse reflection that I talked about off of any surface in 3 dimensions. And the nominal ocular hazard distance for our laser is roughly 10 feet. That is, outside of that, you're safe. So if you're walking by in the parking lot outside the DTRs, you will be safe. The hazard zone just talks about, just like in 3 dimensions, that it would go 10 feet in any of those directions. So some of the non-beam hazards not really applying to this laser would be physical agents, chemical agents, and biological agents. Some of these are in there, such as that we don't worry about noise, plasma radiation, that sort of thing. The chemical agents are all in a protective housing and should really not be an issue for us, as well as biological agents. The classifications for lasers, 3 different groups that we actually follow: the FDA and ANSI standards, and then the IEC, the International Electrical Technical Commission. So these are Class 1 lasers. We can go through these, but these are very safe to use. Class 2, such as laser scanners. Class 3 would be a laser pointer. Class 3B, and we use Class 4 lasers in the dental clinic. Hence why all the protective measures that we go through, that we can use them safely. So just like I said, the standards that we follow, the FDA as well as ANSI, to govern how we use these particular products, we follow them all. Some things for our lasers that keep us safe is a protective housing, safety interlocks, a passcode on there, warning labels, everything you can think of so that we do not damage ourselves and or the patient. The warning labels will always be up when we use a laser on a patient. They need to be hung outside the curtain that will be hung. Some of the other labels, we will not be using these. So this is just an overview of the ANSI standards that we have to follow, as well as working with bio and our laser safety officer. So some of the measures they have are engineering, administrative, and procedural to make sure everyone will be able to treat these lasers safely. Like I said already, we follow all of these guidelines. And we use a Class 4 laser, which there is at the bottom. That the levels of laser radiation are considered to be an acute hazard to the skin and eyes from direct and scattered radiation. That was from the FDA. This is with ANSI as well. Same type of hazards. And once again, not many changes. So which of these classification applies to us? All of them. We do follow all of them. If anything does change, the unit laser safety officer will let the installation know. But our Gemini lasers should not change whatsoever. The control measures that we have, like I said before, engineering and administrative controls, anything that says that should be considered means shall, that we will do it. And like I said before, these are some of the things that we have in place for safety, especially PPE, the housing units, in case something breaks. You can see the rest of them on there. We do not have protective windows, but we do have protective barriers, and they must be in place at all times when the laser is going to be used. If it is in the perio room, then the door just needs to be closed with a sign on the door that the laser is in use. If not in the perio room, the DTRs need to have all of the barriers hung and signs outside letting everyone walking by know there's a laser in use. Eye protection will always be worn by, like I said before, anyone inside the room. So that's the patient, the provider, and the technician, and anyone else that might be inside. Roles, responsibilities, and regulations. So clearly defined at our, especially with our DOI that was created for use of our laser and working with bio to make sure everything is in place for us to be able to use our laser. And this just talks about the program that's already been in place for us to be able to use the laser. Something that needs to be done for any new coming technician or provider is they always have to have a baseline exam before use of the laser, so we can note any changes that happen if you do use the laser, but at least so we know what you started with. And that can be done here in the clinic. So new lasers on the installation that did apply to us, we have gone through everything to make sure we are FDA compliant with the use of our laser, and we follow all the proper protocols. This does not apply to us for using lasers at or above the horizon. So any kind of accidents, incidents, or injuries, You contact your supervisor immediately and seek medical care. After that, supervisor will notify the unit commander, the unit LSO, and the installation LSO. Number is provided. You would want to come get myself if anything like this does occur. These are the references that we discussed and things that we went through. This will be an annual training of what we did. The last noteworthy thing to discuss is in logistics, where the laser is kept with lock and key. There's a sign out sheet for use of the laser, and all the information that is required is on that sheet, and it does need to be filled out for every time we check out the laser. That is it.